Hi, I'm Dr. Sensoli. Welcome to TLC Eye Care and Laser Center. During your visit today, we will do an assessment to see if eyelid surgery is a good choice for you. We will discuss your goals, make some measurements and take photographs, and tell you what benefits you can reasonably expect from eyelid surgery. Remember, the decision to have surgery is always up to you. If you have excess skin and fatty tissue of the upper eyelid, a common procedure called blepharoplasty can be performed. Usually, patients that need blepharoplasty complain of the excess skin causing a heavy, tired feeling, which makes them look aged, and the skin causes loss of their peripheral vision, like blinders on a horse. You may be subconsciously raising your eyebrows and forehead to try to help you overcome this. Over time, this can cause fatigue and wrinkles. We will perform tests today to see if the excess skin is causing you to lose your peripheral vision. If it is, your medical insurance may cover the cost of your surgery. I usually perform blepharoplasty right here in the office under local anesthetic, and you can go home right afterwards. I do want you to take it easy the day of surgery, but you can resume most normal activities the next day. Your stitches will come out in about a week. Blepharoplasty is not an exact surgery. Although we can come real close, we never remove the perfect amount of skin. In fact, we err on the side of leaving too much skin, because if we take too much skin, you won't be able to close your eyes, and that's not a good thing. In general, the worst thing about surgery is the bruising afterwards. Although the bruising goes away within 1 to 2 weeks, you can look like you lost a fight until then. The most important thing to help make your surgery successful is to make sure that you're off all blood-thinning agents. If you're taking Coumadin, Plavix, or other strong blood anticoagulants, you must see your doctor and stop these medicines before your surgery. If you're on milder anticoagulants like aspirin and ibuprofen, which is Advil or Motrin, I ask that you stop those 1 week before the surgery. We will talk shortly to discuss whether or not blepharoplasty is a good option for you. Please feel free to ask me and my staff members any questions that you may have. Thank you for coming today, and I hope I can help you achieve your goals regarding your eyelids.
Upper lid blepharoplasty is done to remove redundant skin from the upper lid that is hanging over the eyelashes or hooding vision and decreasing functional peripheral vision of the patient. Upper lid blepharoplasty may be performed as an in-office procedure or at an ambulatory surgery center. Your surgeon will discuss the best option for you during your consultation. The upper lids are extremely forgiving in their healing process, and complications are extremely rare with upper lid blepharoplasty. Complications may include any untoward reaction for anesthesia. The anesthetic used is xylocaine with 1 to 200,000 epinephrine. Occasionally, your doctor may use Y-days. Epinephrine is used to constrict blood vessels locally and prevent bleeding. Y-days is used to promote dissection of the anesthesia among tissues to promote better anesthesia. Any untoward previous reactions to xylocaine or local anesthetics should be made known to the physician. Postoperative infection, which is extremely rare because of the vascular nature of the lids and the healing process. Lagophthalmos. If too much skin is removed from the upper lids, the patient will have difficulty closing the lids. This may cause slight opening of the lids during sleeping. However, this is rare since blepharoplasty is done as an in-office procedure with the patient awake, and complete closure of the patient's eye is required upon request during the procedure to estimate correctly the amount of skin to be removed and to promote closure of the eyelids postoperatively. Hematoma formation is a blood clot which may need to be evacuated by taking down the wound, removing the clot, and resuturing the wound. Sutures are used to close the incision, leaving the incision in a lid fold. Therefore, scarring is minimal. The scar formed is unnoticeable with eyes open, and over a period of time with the eyes closed, it is difficult to discern. Occasional small stitch abscesses or cysts can be found forming slight bumps along the suture line. However, this is also kept to a minimum with early removal of sutures postoperatively.